It is the WEBO Morning Show, and I am joined this morning from the Addiction Center of Broome County. Good morning to TJ and Jonathan. How you guys doing today?
Hi, Dave. How you doing?
Very good, thank you. Thanks for joining us on the morning show today.
Yeah, thank you for having us.
It's been a little while since we had an opportunity to chat with the Addiction Center of Broome County. And in the meantime, there's been this whole coronavirus COVID-19 pandemic thing going on. And, well, you know, what's going on at ACBC? So many things shut down. I can't imagine that ACBC is shut down as well, right?
No, we're definitely not shut down. The COVID-19 crisis, I think, has been a problem for a lot of folks. In particular, I think people with substance use disorders have really felt those effects. But ACBC is still here, and I think we've actually done a good job of adapting to the challenges that COVID has presented to us.
You know, so a lot of things, of course, social distancing right now and face-to-face, you know, that stuff's kind of difficult. We've all had to change. And, you know, Addiction Center of Broome County, ACBC services are not the kind of services you could just put on the shelf and put on hold for 4 months. I mean, you know.
No, you really can't. You can't delay any of these kinds of services. You know, they often say the disease of addiction benefits from isolation. And so, like you said, the idea of the social distancing, limiting social gatherings, all of those things poses a problem for someone who's working on their recovery. It can be very disruptive. But again, we have been able to sort of modify our services. I think we've actually gotten a little bit more flexible. And we're currently offering in-person individual sessions. And we're also offering telepractice services as well.
So tell us a bit about that. How does it work?
Okay, so the individual in-person session sort of speaks for itself. The clinician and the patient would get together. They would meet face-to-face, go over their treatment plan goals. The telepractice services can look a number of different ways. It can simply just be a phone call between the clinician and the patient, just a telephone call. We also have a platform that's similar to Zoom, similar to what we're using right now. It's more safe and it's more secure. And on that particular platform, we are offering group therapy, actually. So we're doing group over the computer.
Interesting. You know, I guess that's the way everybody's doing the meetings now, right?
Yeah, it is interesting. Certainly, I think initially there was sort of some technical glitches. There's some audio and video issues. You probably know better than most. It can't really replace an in-person interaction.
Certainly not.
But it is certainly better than nothing, and we're pretty proud to be able to offer that.
Excellent. So, what about your outpatient services? How are you handling things like that?
And so again, at this point, in terms of outpatient services, we are seeing people individually in person. Obviously, we would love to do in-person groups. We're not quite there yet.
Yeah.
Because, you know, obviously that poses particular challenges, right? You've got a lot of people in one space. How are you going to be able to social distance? How are you going to be able to make sure that there's a limited amount of people in one particular space? So we are working on a plan to do in-person group therapy, but we have to make sure it's safe. We have to make sure it's safe for the patients. We have to make sure it's safe for the staff. So we're sort of carefully considering a couple of different options, and once we feel comfortable with a plan, we'll let people know.
Excellent. Now, Jonathan, how about your end of things? Right, you oversee some different programs as well.
Yeah, I'm here to mainly talk about the medication-assisted treatment portion of our program here at ACBC. It's a really important piece of the puzzle for a lot of people struggling with addiction, the disease of addiction. Especially during this time, during COVID, when face-to-face isn't always possible. They have this, you know, something that they can take daily or monthly to help, you know, keep them covered essentially, at least from a, you know, physiological standpoint. The medication that we offer here. The main ones are Suboxone, Vivitrol, and Naltrexone, which is an oral form of Vivitrol, which is a monthly injection. And we offer those things, like I said, mainly to help kind of bolster, the treatment process. For a lot of people, being on something daily or even monthly, like I said, can really help people, especially in addition to traditional therapy. It's a good recipe for success for a lot of people. So
I'm sure you
that's
need
what I try to do.
you need something like that helps keep cravings and withdrawal and things like that down. I mean, the individual and group sessions are great, but waking up one day and saying I'm going to stop using now and I'm going to go to sessions and that's going to make it all better. You can't ignore that there's a physical demand to get off of substances and to get free and clear.
Yeah. I try to think about it there's so much mental work that has to be done a lot of times to, in recovery. So getting the medication piece first. So like you said, to kind of curb any sort of cravings or physical manifestations of withdrawal. It's a lot easier to start putting in that mental work after those things are addressed. And you're a little more comfortable. And same with the other thing that I wanted to talk about, which is the psych services that we offer here as well. And that can be another huge piece of the puzzle there. A lot of times we see people, struggling with addiction, also have co-occurring mental health disorders. So it's really fairly common to see those two things present at the same time. And so if we can treat that piece, it just makes it easier for the patient and for the clinicians to help, anyone struggling with addiction, and especially the ones who might have a co-occurring mental health disorder, which I said is really common.
Substance use and abuse is a multifaceted issue. I mean, there's just so many layers to have to deal with. And if you only deal with one at a time, it all kind of comes apart. You have to manage everything all at the same time and, keep it together.
That's what's nice about ACBC. We have a lot of, people here we love what we do, and we have a great team that kind of attacks, like you said, from all angles, because there's so many different layers. So, and just quickly, I wanted to say that if anybody out there listening has any questions about any sort of medication-assisted treatment, you could get in touch with us at ACBC and ask for any nurse or anyone that you wanted to talk to. Will help you here and get you to the right person and get you set up if you're needing help. Please don't be afraid to call.
Now, you guys are the Addiction Center of Broome County, but you don't just serve Broome County. It's also Shenango, Tioga, Tompkins counties as well. You have 2 locations, Binghamton and Endicott as well, right?
Yeah, that's correct. Yeah, we're serving an awful lot of people at this point. If I could, Dave, just quickly talk about peer services as well.
Yes.
So I've been at ACBC for over 7 years. And I was a clinician for over 4 years. One of my big frustrations when I was a clinician was, although I was doing a lot of good work, I was sort of confined to this agency. I was confined to this space. I wasn't able to help people outside of these walls. And that's where our peer services really come in and fill that void, right? Because they're able to work with the patient outside in the community, work right alongside them, and secure, food, clothing, shelter, provide transportation. And so they're just a huge complement to the other services that we provide.
Boots on the ground troops to help you get it done in the field.
Boots on the ground, hugely important.
How do we get this process started if we're starting from nothing?
Yeah,
where do we go?
Great. It's a great question. Everything starts with an assessment. And so what I would say is contact 723-7308, extension 118. You reach reception. You can schedule an admissions assessment. From there, once you come in, the assessor will ask you a series of questions. They'll determine what kinds of services and supports that you need, and then we kind of go from there.
Give them a call, ask for help, or flag them down if you see them on the street.
Yep.
Please, absolutely, yeah. And one other thing too, if folks had some additional questions or they were looking for additional information on the services that we just talked about, we do have a very cool and brand new website. It's acbcservices.org. So we encourage people to check that out as well.
Excellent. TJ and Jonathan from the Addiction Center of Broome County. Guys, thanks so much for joining us on the WEBO Morning Show today.
Thanks so much
Thank you for having us.